Welcome back, everyone. The thyroid affects nearly every part of your body, from your heart and brain to your muscles and skin. So it's no surprise that an underactive thyroid can lead to many different serious issues. Here to tell us more on how we can spot the signs is Clinical Director at Total Wellness Solutions, Dr. Andrew Bridgeforth. Welcome, Doctor. Thanks so much for being with us.
Thanks for having me.
Well, this is so important of a topic to discuss. Millions of Americans suffer with thyroid issues, and a lot of people might go undiagnosed, misdiagnosed, and or get diagnosed and still not feel better.
Right, and that's one of the things that we see in our office. We see a lot of people that go to their doctor and they get diagnosed as hypothyroid, and they wind up on a medication, but the symptoms still remain, and that's a frustrating thing for them, and that's where we try to focus our care.
Okay, back it up. What is hypothyroidism?
Okay, so hypothyroid, hypo is the term for low, so it's a low thyroid function, and so when they do this, they'll go to their doctor and they're going to get a lab test, and usually they'll look for something called TSH, and the TSH is called thyroid stimulating hormone. It actually comes from your pituitary to tell the thyroid in your neck here to put out the hormone. So when it's low functioning, that may be one of the reasons for it, and that's why they run the lab test.
Okay, so you're going to get diagnosed in all cases by getting that lab test done, correct?
Right. Your medical doctor is going to diagnose you. Many times they wind up putting you on thyroid hormone to try to bring the thyroid function up. But in many cases, what we see in our offices, many people are still having the weight gain. They can't lose the weight. They're tired all the time. Their hair's still falling out. Outer third of the eyebrow even kind of goes out. There's a lot of different symptoms, brain fog. And they're really frustrated because when they've gone to the doctor, it's basically, okay, here, your numbers look better, we've given you the medication, and this is where they feel stuck.
Right. Well, your numbers may look better, but if you're not feeling any better, that's so frustrating. So let's talk about that. What are you seeing as some of the most common treatments that people are getting, and why are they per se not working?
Well, the most common treatment is the thyroid hormone. And the thyroid hormone is such an important thing to have. It's so important that we obviously recommend anybody go to their doctor and make sure and get that checked out and get the hormone to see about balancing the hormone levels. But what we find is there's other things going on in their physiology that are driving this. Some people we find that have an underlying immune condition, and where the thyroid actually becomes the victim rather than the problem itself. So we really look for these different patterns when we do lab work and things like that to try to find out what's driving this problem and why they're experiencing all these other symptoms. And our focus is less on medications and thyroid itself, but what are the underlying things and why can't they lose the weight? And trying to find results with that.
Exactly, and it kind of takes you digging a little bit deeper, which a lot of times maybe your primary care physicians, nothing wrong with them, you know, we're total support of them, but they're not necessarily kind of peeling back the onion and getting to the heart of where this malfunction started.
It's just not necessarily in the playbook to do that.
Right.
And that's where we come in. We have a little bit different playbook we operate from.
And how is your program different?
Well, what we focus on is we're actually looking at a lot of different other labs and focusing on what's going on in their body. What else is going on? Listening to them is one of the most important things that we want to do. I mean, one of the things that I always say to women is, because mostly we see women with thyroid conditions, is, gosh, you know, I've got 3 girls myself. I mean, at the age of 12, 13, your body starts to change, so you start recognizing things about your body every month. For years and years. So women know their bodies very well.
I would agree with that.
So the whole important thing that we do in our office first, that what I do is listen. I need to find out what you're saying and listen to it and hear what you're saying and not just dismiss it and say, well, the labs look fine, your labs are back in normal, so everything's fine. There's more going on.
Absolutely, and I'm hearing that frustration from so many women my age, friends of mine that are in their mid to late 40s after children, saying, I'm just not feeling like my old self. There's something really wrong, and again, it goes back to knowing who you are and knowing your own body and really trying to get to the core of what that issue is. It isn't just the holiday season, or it's not just stress at work. These issues are very real, and there is a reason it all starts.
Absolutely.
And so I know when you say that you have this different approach, who would you say then that's listening is the ideal candidate?
Well, I think it's somebody that what we've talked about, what you just described, your friends, that are these people that are frustrated. They're tired of feeling this way. You know, as they say, sick and tired of being sick and tired. They're tired of not having any energy. They're tired of not being able to lose the weight. But yet when they've gone to their doctor, what the labs say is everything's fine. So, and I kind of equate it to like a car. You know, if you had a car where it's running rough and there's smoke coming out the back, but the check engine light's not on, we know that it's not fine. And we don't wait till the check engine light comes on to go get it checked out. And in the medical model, from what I see it, is you take your car in and they get a way to get the check engine light off, but it's still running rough. There's still smoke coming out the back. And that's the issue. So we're investigating a little bit more. It's not just focusing on the check engine light. We got to find more that's going on.
Absolutely. And you have a great offer for Atl&Co Company viewers to get them started today, not at the beginning of next year, like now, feeling great throughout the holidays.
Absolutely. So for the first 20 callers, we want to offer a free consultation. so they can come into the office and sit down. I want to hear what's going on with them and let them know how we do things that are a little bit different. So for the first 20 callers, they can call the number on the screen, and we'll be happy to talk to them and hopefully get them in.
So much, Doctor. I appreciate it. And also, where are you located? I forgot to ask you that.
Oh, we're in Dunwoody.
In Dunwoody. Excellent. Easy to get to from wherever you are.
Absolutely.
Thank you so much. Such an important topic again, and people just want to feel better sooner than later. So
Definitely.
this may be the solution for you. Again, for more information, get in touch with Dr. Bridgeforth by calling 404-850-9777. And this segment was paid for by Total Wellness Solutions. Call today.